All right, welcome, Dr. Erickson, EHS Physical Therapy, Chiropractic, as well as herniated disc fix.
Yep, I'm Dr. Jake Anderson with Essential Motion Spine and Sport. I'm a chiropractor out here.
So we often work together. We do a lot of work with spine. So we each had our own spine today. But how will you determine? And this is the scary part, and really it's the confusing part for you, as the person that's going through this pain. How do I know if it's my facet joint? So facet joints look like this. It's these little guys that actually articulate together and produce the movement. So that's a facet. So how will I know, Jake, if it's my facet joint causing pain or if it's my disc causing pain? Because on an advanced image or a scan, right, X-ray, CT, MRI, it's very common, depending on, like, I'm in my 40s, it's probably going to show both. You have some facet arthritis or degenerative changes, maybe some disc changes, and the symptoms can mask each other very closely. So in order to differentiate, I mean, in actuality, it doesn't really matter, but let's talk about some of the differences possibly that you could feel.
Yeah, so like Chris said, on the advanced imaging, you'll see words like facet or disc, and these will get your head spinning like, okay, what is it? Which one's actually hurting? And for the most part, there's a lot of overlap between these structures. That's why
you can see how close they are.
Yeah.
I mean, they both are almost next to this. So here's the nerve root that could potentially send some pain, like down, an arm or leg. And the facet joint is right behind it, right?
The disc is right in front.
And they close down and move, and the disc is right in front of it. So it could be either.
Yeah. So in the grand scheme of things, this is why low back pain is often lumped into the term mechanical low back pain. This is pain that changes with movements, positions, loads. For the most part,
typically intermittent.
Yeah. And to be just frankly honest, we cannot tell with 100% certainty if it's one specific structure, whether it's the facet or the disc. And honestly, it doesn't really matter because it only matters is if you can change the symptoms.
Yep.
But going off the idea here of whether or not we're trying to differentiate
is it
between
most likely?
Yeah, most likely
cannot,
disc or most likely facet.
100% be sure where it's coming from. No.
Yeah, so let's just go with a disc. A disc is going to change quicker and symptoms are going to be a little bit more broad. So you can have more pain in extension, pain in flexion, pain in the middle of the movement. That would be more discogenic in nature.
Or return, like it's not so bad here, but then returning through the pain, there could be more dynamic losses of motion, where one day I feel like I can move pretty good, and then the next day I can't move at all. You could get stuck.
You're more
rapidly reducible.
You're more likely to see referred pain, so pain in different locations outside of the spine, pain down the hip, into the leg, or into the foot. That would definitely scream disc more than facet. Now, if we're talking specifically the joint, you'll likely have more one-sided pain, not diffuse. It'll be localized, one side, local. You might have pain to the touch, pain with pressure, pain to palpation. And if you load into that movement, so in my case there,
backwards.
Leaning back into that joint, closing that joint down.
Closing it down right there.
You're basically pinching those structures together, and that can produce pain, which would be more facet joint related.
Where a disc, you might actually get good reduction. It might feel like, the more I do it, the better it feels, as opposed to, so there's some of the differences right there.
The key thing to understand though is it doesn't overall change treatment approach.
No, we still have to assess and reassess and go over what is, what's better and worse, and what are the movements that are actually, cause and effect wise, changing the symptoms, improving the range of motion, improving the pain, location, and intensity.
And then just returning to function is the biggest thing.
So quickly as possible.
It's important to understand that if you have seen these words on your X-ray or MRI, facet arthropathy, facet arthritis, DJD, DDD, disc degeneration, disc herniation, don't let those words scare you alone. Most of these issues can be managed conservatively with things like what we do in the office here, chiropractic, physical therapy. I mean, we treat those kind of things all day long. And most of them respond well without having to go through expensive drugs or surgeries or anything crazy like that. You can manage it with hands-on care and exercise therapies.